still remain after root planing. After making sure all the areas are completely numb, we gently separate the gums from the tooth. This creates a flap and gives us access to the infected areas. We then remove any plaque and tartar from the root surfaces. The area is reshaped, and the gum line is adjusted to make it easier for you to keep the teeth plaque-free. Any soreness after surgery can usually be handled well by mild pain medication. Periodontal flap surgery removes the source of infection, reduces the size of the pockets, makes cleaning easier, and raises your overall level of health. When everything is healthy, your gums are snug against the teeth, and the root doesn't show. Unfortunately, in some cases we see something more like this. The gums have pulled away from the tooth, and some of the root surface is exposed. This apparent lengthening of the teeth can really age a person's smile. If left uncorrected, the loss of protective gum tissue may also mean even more severe problems down the road. Fortunately, a procedure called grafting can correct this problem. The first step in placing a graft is to thoroughly numb the involved areas. Then the graft is taken from the donor site on the palate. In some cases, the incision heals on its own. In other cases, it's closed with a stitch or two. At the site of the graft, we gently separate the gums from the tooth. This creates a flap and gives us access to the area. We then carefully remove any plaque and tartar from the root surfaces. The graft is strategically placed and carefully stitched in place. After healing for a few weeks, the grafted tissue blends in beautifully. The results? The gums have been restored and strengthened, the root surface is covered and protected, and the tooth now has a much more natural and pleasing appearance. Healthy gums, tight against the necks of the teeth, are an important part of a beautiful smile. But sometimes a problem like this can develop. As the gums extended onto the front surface of the teeth, the natural balance between the length of the teeth and the height of the gums was lost. The first step in a gum reduction procedure is making sure that all of the involved areas are completely numb. We then carefully make a small incision and remove the excess gum tissue. After a couple of weeks, the area will be completely healed. Notice how much more natural this area looks after the procedure. A gum reduction procedure is a safe and predictable way to remove excess gum tissue and improve the natural appearance of a person's smile. When a tooth is broken down due to decay or fracture, a crown is an excellent way to cover and protect it. In cases like this, when the damage is more severe, there may not be enough remaining tooth structure to adequately support a crown. Years ago, a tooth like this would have to be extracted. But today, by using a procedure called crown lengthening, we can increase the amount of available tooth structure and save the tooth. The first step in this procedure is thoroughly numbing the entire area. Incisions are placed and the gums are gently pulled back. The area is then reshaped and sculpted to the desired shape. The gums are replaced and a couple of stitches are placed to speed healing. After a few weeks of healing, a crown is placed to cover and protect the damaged tooth. Crown lengthening is a minor surgical procedure that is a predictable and effective way to save a tooth that might otherwise be lost. If you have periodontal disease, your choices are limited. You may choose treatment or to delay treatment. Treatment involves a combination of root planing, new home care techniques, more frequent dental cleanings, and in severe cases, surgery. Delaying treatment will never make periodontal disease go away. Periodontal disease is an ongoing degenerative disease. Bone lost never grows back. If too much bone is lost, teeth get loose and have to be removed. This means you may end up wearing partial dentures or even full dentures. You don't have to lose your teeth to periodontal disease. Treatment removes the infection and keeps the disease under control. By now, almost everyone knows that cigarette smoking has been linked with lung disease, cancer, and heart disease. But most people aren't aware of the effects of smoking on their oral health and its role in increasing the risk of periodontal disease. Smokers are more likely to have calculus, which is plaque that hardens on your teeth, deep pockets between your teeth and gums, the loss of bone and tissue that support your teeth, and chronic periodontal disease. Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. To understand how smoking increases your risk of periodontal disease, it's important to understand how the disease develops. The main cause of periodontal disease is plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar, which is also called calculus. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. Bacteria that thrive in plaque and calculus produce toxins, and it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Smoking helps cause periodontal disease in several ways. It reduces the amount of saliva production, and therefore the number of disease-fighting antibodies that are in saliva. Lower saliva production also causes increased plaque and calculus formation, and it damages your immune system, causes blood vessels to restrict throughout your entire body, which reduces blood flow. Since your body needs white blood cells to fight off infection, the reduction in blood flow to your gums makes it more difficult for your body to fight the disease-causing bacteria in your mouth. Besides contributing to the onset of periodontal disease, continuing smoking after your treatment makes it much, much harder for your gums to heal. To successfully treat periodontal disease, we remove all of the plaque and bacteria from your teeth. It's critical for you to then maintain a plaque-free mouth. The reduction of saliva caused by smoking makes that job much harder. As we've learned, if you're a smoker, your immune system may not be up to the task. There are more than 4,000 chemicals found in cigarette smoke, including formaldehyde, carbon monoxide, ammonia, and arsenic. The bottom line? Smokers are 4 times more likely to have advanced periodontal disease and twice as likely to lose their teeth. So if you haven't yet considered quitting smoking, now you know another benefit. By becoming a non-smoker, you can strengthen the fight against periodontal disease and keep your teeth. Gingivitis is a swelling and discoloration of the gums. There is usually no pain or discomfort associated with gingivitis. It's the mildest form of gum disease, and its effects are reversible. But gingivitis can be the gateway to periodontal disease, a much more serious condition which can lead to irreversible bone loss and eventually tooth loss. The main cause of both gingivitis and periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes and becomes tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it starts to get into the root surfaces. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Bacteria that cause periodontal disease thrive here. Bacteria, like the ones in this slide, produce toxins. And in periodontal disease, it's these toxins combined with your body's reaction to them that destroys bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there is so little support for the teeth, they get loose and have to be removed. Though most people aren't aware of gingivitis, the warning signs are redness where the gums and tooth meet, swollen gums, bleeding when brushing and flossing, and bad breath. To determine whether or not you have gingivitis, we'll perform a thorough examination. We'll look for any changes in gums shape, color, and contour, and bleeding in the gums upon probing, take X-rays to check for bone loss, and use the periodontal probe to measure bone levels around the teeth. The measurement is from the bottom of the pocket where the gums are attached to the tooth to the top of the gums. Normal readings range from 1 to 3 millimeters. These are healthy gums. They're tight against the teeth and there aren't any pockets. Now take a look at the difference in a case of gingivitis. Notice how swollen and red these gums are. If we determine that you do have gingivitis, treatment always includes a professional cleaning which removes plaque from teeth, as well as a consistent home care regime and a revisit schedule. Depending on the needs of your treatment plan, we may decide that it's important for you to visit us more frequently for professional cleanings while we treat your gums. In some cases, additional steps are required, which could include using a disclosing solution to determine where the plaque is, a review of the proper use of a manual or electric toothbrush, the use of dental floss to clean between teeth, and using an antibacterial rinse to help kill destructive bacteria. In the past, gingivitis and periodontal disease and tooth loss were considered an inevitable part of the aging process. We now know that it has nothing to do with aging. And if we work together to keep the plaque off your teeth and keep your gums healthy, you can avoid tooth loss and maintain a healthy smile. If you are diabetic, you're at a greater risk of suffering from oral infections and diseases, including periodontal disease. Why? Because diabetes frequently causes blood vessels to thicken and become less elastic, which decreases the flow of oxygen and nutrients to the body's tissues, and slows the removal of harmful wastes. This can weaken your mouth's resistance to infection. Also, the harmful bacteria in your mouth that are responsible for periodontal disease thrive on sugars, including glucose, the sugar linked to diabetes. If diabetes isn't controlled properly, high glucose levels in your saliva feed these bacteria and set the stage for gum disease. And interestingly, the reverse is also true. An infection in the gums makes it more difficult for you to control your blood sugar. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. The bacteria hide in pockets next to the teeth, where the gums have pulled away from the tooth surface in response to the infection. Diabetics who don't successfully control their blood sugar levels also often experience a decrease in the flow of saliva, which can lead to a condition called dry mouth or xerostomia. Having a dry mouth may seem to be nothing more than an irritation, but it can cause some serious oral health problems. A lack of moisture in the mouth allows plaque, the sticky film of food residue and bacteria, to build up on teeth. And plaque accumulation is the main cause of periodontal disease. It's important for everyone, especially diabetics, to remove plaque from their teeth each day by flossing and brushing, and to visit us regularly, or it may build up and harden to become tartar or calculus. To help prevent bacterial infections in your mouth, we may prescribe antibiotics, medicated mouth rinses, and more frequent dental cleanings. With good dental and medical care, your gums and teeth can remain healthy and free of periodontal disease. Researchers have discovered that if you have periodontal disease, you may have an increased risk of coronary heart disease and stroke. Periodontal or gum disease is an infection of the teeth, gums, ligaments, and bone that surround your teeth. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. The bacteria get onto the root surfaces of your teeth and cause pockets of infection to form. The bacteria hide and multiply in these pockets, resulting in tender, red, swollen gums that may bleed when you brush or floss. Bleeding gums can create an open doorway that may allow harmful plaque bacteria to enter your bloodstream. Severe periodontal disease can be compared to a 9-square-inch open wound around your teeth, offering significant opportunity for harmful bacteria to enter your blood. Bacteria associated with periodontal disease have been linked to the formation of blood clots that can block your arteries and even trigger a heart attack. They also cause fat-like substances to build up in the arteries in the carotid arteries within your neck. Worst-case scenario, if these fat deposits break apart and are carried away in your bloodstream, they can lodge in your brain, block a blood vessel, and cause a stroke. Studies have also shown that when plaque bacteria enters the bloodstream through infected gums, you can develop a heart condition called infective endocarditis, This is a potentially fatal bacterial infection, which causes the sac around the heart to become inflamed. So as you can see, it's vital to your overall health as well as your oral health to keep your gums free of disease. If we determine that you have periodontal disease, we'll recommend an appropriate treatment plan and we'll work with you to create a suitable oral hygiene routine. Wondering why you have persistent episodes of pneumonia or bronchitis? The answer may be hiding in your gums. Scientists have discovered a link between periodontal disease and respiratory infections. In fact, if you suffer from periodontal disease, you may be breathing harmful bacteria into your lungs every day from the infection in your gums. As you breathe in, these bacteria enter your lungs where they can breed and multiply. Evidence now indicates that bacteria in your lungs can lead to respiratory infections like pneumonia, bronchitis, emphysema, and chronic obstructive pulmonary disease. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It needs to be thoroughly removed every day, or it builds up and hardens to form tartar, which is also called calculus. The blue spots here are tartar. There's no way for you to remove tartar at home. A toothbrush or floss won't even budge it. It takes a professional cleaning to get rid of it. If tartar isn't removed, it gets onto the root surfaces where it can cause pockets of infection to form in your gums, trapping bacteria. The bacteria, like the ones in this slide, produce toxins, and it's these toxins, combined with your body's reaction to them, that permanently destroys bone around your teeth. And now you know that these same bacteria can enter your lungs every day and may increase your risk of respiratory infections. If we determine that you have periodontal disease, we'll recommend an appropriate treatment plan, and we'll work with you to create a suitable oral hygiene routine. Prompt treatment of periodontal disease removes the source of bacteria, allows your gums to heal, and stops the progressive loss of bone. The added bonus? You'll increase your overall health and reduce your risk of respiratory infection, so you'll be breathing easier. When you're pregnant, you know it's vital that you take particularly good care of yourself, both for your own health and that of your unborn baby. What you may not know is that it's also important to be mindful of your oral health during pregnancy. Why? Because during pregnancy, your body produces higher levels of hormones, estrogen and progesterone. Elevated hormone levels cause your gums to overreact to plaque, the sticky film of food residue, saliva, and bacteria that's constantly forming on your teeth. As a result, your gums become more vulnerable to developing periodontal disease, an infection of the gums and bone that surround the teeth that, left untreated, can lead to tooth loss. In fact, some pregnant women develop a condition known as pregnancy gingivitis, which shows symptoms of swollen, red, and tender gums that may bleed when they brush or floss. Gingivitis is an early form of periodontal disease. Pregnancy gingivitis is most likely to appear in the second trimester and peak in the middle of the third trimester. If you already had gingivitis when you became pregnant, it's likely that the condition will worsen as your pregnancy progresses. Your pregnancy also puts you at risk for developing pregnancy tumors, which are large, non-cancerous growths around or between teeth that develop from swollen, irritated gums. Gingivitis can also affect the health of your baby. Excessive plaque bacteria can enter the bloodstream through your gums, travel to your uterus, and trigger the production of prostaglandins, a chemical in your body that is believed to cause premature labor. The result? Your baby could be born too early and too small. To keep plaque from building up and hardening on your teeth, you should clean your teeth after each meal, use dental floss, a toothbrush with soft bristles, and use fluoride toothpaste. If toothpaste makes you feel nauseous, you can brush with plain water and rinse with an anti-plaque or fluoridated mouthwash. We'll keep a close eye on your oral health throughout your pregnancy, cleaning your teeth as needed and monitoring the effectiveness of your home hygiene routine. Be sure to ask us if you have any questions about oral health during your pregnancy. A healthy mouth will help to ensure a comfortable pregnancy and a healthy baby. Throughout your pregnancy, you'll be hearing a lot about how your health affects your baby's health. Now, researchers have discovered that women with periodontal disease are 7 times more likely to deliver a preterm, low birth weight baby than women with healthy gums. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day or it builds up and hardens to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. If it isn't removed, it gets onto the root surfaces of your teeth, where it can cause pockets to form in your gums, trapping bacteria. The bacteria, like the ones in this slide, produce toxins, and it's these toxins combined with your teeth's reaction to them that destroys bone around your teeth. Scientists believe the link between periodontal disease and preterm birth is due to the body's reaction to the bacteria that exist in the infected gums associated with even mild forms of periodontal disease. Gums infected with periodontal disease are toxic reservoirs of disease-causing bacteria. These bacterial toxins attack the gums, ligaments, and bone that surround your teeth, creating infected pockets that are similar to a large open wound within your mouth. This creates a doorway to your bloodstream, where bacteria can enter and travel throughout your body. Your body reacts to this infection in your gums by producing prostaglandins, a natural fatty acid that's involved in inflammation control and smooth muscle contractions. During your pregnancy, the level of prostaglandins produced by your body gradually increases and then peaks when you go into labor. If extra prostaglandins are being produced in response to an infection in your gums, one theory is that your body may interpret this as a signal to go into labor, and your baby could be born too soon and too small. Preterm babies aren't as healthy as they could be. Complications caused by early delivery or low birth weight account for 60% of infant deaths. The good news is that an infection in your gums is an infection you can prevent by flossing daily, brushing at least twice a day with a soft bristled brush and a fluoride toothpaste. If brushing makes you nauseous, brushing with plain water and then rinsing with an anti-plaque or fluoridated mouthwash. And seeing us regularly so we can clean your teeth as needed and monitor the effectiveness of your dental hygiene routine. In primary teeth, when deep cavities are in the nerve or close to the nerve, it's sometimes necessary to perform a pulpotomy. A pulpotomy is the removal of the irritated part of the pulp while leaving the healthy root canals intact. A pulpotomy usually involves 4 common steps. First, we make an opening into the tooth and remove the part of the nerve in the top of the tooth. Next, we place medication to promote healing. And then we crown the tooth to seal it and protect it. We want the entire procedure to be comfortable for your child, so the first thing we do is make sure they're thoroughly numb. We place a rubber dam around the tooth to isolate it from the rest of the mouth. It protects like a safety net. Nothing can fall to the back of the throat. To get at the irritated tissue, we make an opening through the top of the tooth down into the pulp chamber. We carefully clean out the nerve tissue and then place a medicated packing. Sometimes the medicated packing is removed, and sometimes it's left in place. The last step in the procedure is a crown. It seals and protects the tooth. Small cavities in primary teeth can be fixed with fillings because there's still plenty of supporting tooth structure. However, large cavities need to be fixed with crowns. Crowns strengthen a damaged tooth by covering and protecting it. Crowns for primary teeth, unlike crowns for permanent teeth, can be placed in only one appointment, are relatively easy for children to take care of, and are much less expensive than adult crowns. We want the entire procedure to be a comfortable one, so the first thing we do is make sure the tooth is thoroughly numb. Then we remove any decay and shape the tooth with the handpiece. A crown is selected, trimmed, and shaped, and adjusted until it precisely fits the tooth. We then cement the crown in place. After double-checking both the fit and the bite, your child will have a new stainless steel crown. When the nerve of a baby tooth becomes infected, a pulpectomy can save the tooth. As in a root canal in an adult tooth, a pulpectomy involves removal of the infected nerve and the placement of a filling material. Though treatment is individualized in each case, there are 4 common steps to a pulpectomy. First, an opening is made into the tooth to get at the infection. Then the infected nerve tissue is removed. A filling material is placed in the root canals. And then a crown is placed to seal and protect the tooth. We want the entire procedure to be comfortable for your child, so the first thing we do is make sure they're thoroughly numb. We place a rubber dam around the tooth to isolate it from the rest of the mouth. It protects like a safety net. Nothing can fall to the back of the throat. To get at the infection, we make an opening through the top of the tooth down into the pulp chamber. We carefully clean out the infected tissue and then place a filling material. The last step in the procedure is a crown. It seals and protects the tooth. Proper toothbrushing involves 4 things: a soft toothbrush, toothpaste with fluoride, the correct angle of brushing, and brushing in a pattern. It's important to brush at least twice a day, after breakfast and before bed, using a soft toothbrush. A soft toothbrush also makes it much easier to remove the plaque below the gum line, where periodontal disease starts. Use a pea-sized amount of toothpaste that contains fluoride. Fluoride hardens the outer enamel of the teeth. It might stop a cavity in its tracks and give you more resistance to future cavities. Angle the bristles of the brush along the gum line at a 45-degree angle and apply firm pressure so the bristles slide under the gum line. Vibrate the brush while you move it in short back and forth strokes and in small circular motions. Brush 2 or 3 teeth at a time. Then move to the next teeth, allowing some overlap. Tilt the brush and use the tip to brush the backs of the front teeth. It's fine to brush in any regular pattern you choose, but since the insides of the teeth tend to get less attention, you might start with the insides of the upper teeth, then go to the insides of the lower teeth, switch to the outsides of the upper teeth, and then the outsides of the lower teeth. Brush the chewing surfaces of the upper teeth, then the lower teeth, and end by gently brushing your tongue and the roof of your mouth. This removes germs and keeps your breath fresh. Most cavities in periodontal disease begin between the teeth. While brushing is important, the bristles of your brush simply don't reach between the teeth. To keep your gums and teeth healthy, you must remove the plaque between your teeth at least once a day. That's why we recommend dental floss. Wind 18 inches of floss around the middle fingers of each hand, leaving about 5 inches between your hands. Pinch the floss between your thumbs and index fingers and leave about 1 inch in between to work with. Gently guide the floss down between the teeth using a side-to-side motion. If your teeth are too tight to floss, or if it catches or tears, let us know about it. These are problems that need to be fixed. Pull the floss tightly in a C shape around the side of the tooth and slide it under the gum line. Clean the surface of the tooth by using an up and down motion, not side to side, until the surface is clean. When all the plaque has been removed, you'll hear the floss start to squeak. Then pull the floss around the next tooth and repeat the process. Wind the floss to a fresh section and gradually work your way around your mouth, cleaning both sides of every tooth. If your gums are infected, they'll bleed when you floss, and that's to be expected if you are just beginning to floss. After a week or so of regular flossing, the bleeding should go away. Now you know why brushing your teeth is only half the battle. Most cavities and periodontal disease start between the teeth, where your toothbrush simply doesn't reach. As soon as your child gets their first teeth, you should begin cleaning them with a soft infant toothbrush using water only. No toothpaste is needed until age 2 or 3. When your child is comfortable with a toothbrush, brush their teeth twice a day with an extra soft toothbrush. Use a pea-sized amount of toothpaste if your child likes toothpaste. Otherwise, it's fine to brush without toothpaste. Gently floss your child's teeth each day and pay particular attention to areas where the teeth are close together. Regularly help your child brush and floss until they're 7 to 10 years old and able to effectively keep the plaque off their teeth by themselves. After that, check their efforts occasionally. It's a good idea to keep some disclosing tablets on hand. The pink dye in disclosing tablets stains missed plaque red and makes it much easier to see. Fluoride is an important preventive tool for infants. It's important that we first check the fluoride level of your child's primary source of drinking water. We sometimes prescribe fluoride tablets and generally recommend fluoride toothpaste and fluoride treatments here in our office after cleanings. The most serious dental problem for young children is called early childhood caries, or bottle syndrome. It's caused by the constant presence of milk, formula, or fruit juice in a child's mouth during the night, during breastfeeding, during naps, or for extended periods during the day. Use water at these times to prevent this severe decay of baby teeth. And always clean your child's teeth immediately after each feeding. Children learn best by imitation, so let them watch you as you brush and floss your teeth. Regular praise of their home care efforts and a positive example will get your child started down the path of excellent oral hygiene. Disclosing tablets are made up of a harmless vegetable dye that stains plaque red. The main cause of cavities and periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. You must remove all of the plaque each day, or else it builds up and mineralizes to become tartar, which is also called calculus. The blue spots here are tartar. It takes professional help to remove tartar. There's no way for you to remove it at home. A toothbrush or floss won't even budge it. Disclosing tablets can help you prevent cavities and periodontal disease by helping you see the plaque that hasn't been removed. Then you can remove it before it hardens to become tartar. After brushing and flossing, simply chew a disclosing tablet, swish it around your mouth, and rinse with water. Using a small dental mirror, check your teeth for any signs of red, especially near the gum line. Brush and floss these missed areas, and you can be confident that your teeth are plaque-free. When you have braces, it's tougher to keep your teeth plaque-free and avoid cavities. Use a soft toothbrush and a toothpaste with fluoride, and be sure to brush after every meal. Brush every surface of every tooth, and give extra attention where the brackets and bands meet the tooth and where the tooth meets the gum line. Brush in small circular motions, brushing 2 to 3 teeth at a time. You must also floss your teeth because the toothbrush bristles simply can't remove the plaque between your teeth. Thread the floss into the floss threader and slide it up under your arch wire. Then pull the floss between your teeth. Pull it into a C shape and then move around your mouth, flossing both sides of every tooth. After you're done, check carefully to see if you've missed any areas, and then rinse thoroughly with a lot of water. Cutting down on sweets will help avoid cavities, so avoid sticky, sugary foods. Beware of hard foods such as corn nuts and ice. They can damage your braces. Eating softer foods and cutting harder foods into smaller bites is your best bet. Watching your eating habits and careful attention to your daily home care will keep your mouth healthy and keep those teeth looking good. It's well known that sports mouth guards are mandatory for high-contact sports such as football and hockey. But you may not know that the majority of mouth injuries occur in children between the ages of 7 and 14, often while skateboarding or simply riding a bike. The most common mouth injuries are broken or lost teeth. But accidents may also cause jaw fractures, jaw joint problems, jaw dislocations, or concussions. The American Dental Association estimates that each year the use of a mouthguard prevents 200,000 injuries. There are 3 common types of mouthguards: stock, boil and bite, and custom-made. Stock mouthguards are used off the shelf with no modifications and offer little or no protection. Boil and bite fit somewhat better but are not thick enough to provide the critical support necessary. Custom-made mouthguards are by far the best solution. They offer maximum protection, increased breathing ability, allow easier communication, and they're more durable, which means less frequent replacement. To fabricate a custom-made mouthguard, on the first appointment, we take impressions. From these impressions, we make models, and it's on these models that the laboratory fabricates the mouthguard. On your second appointment, we try in and adjust your mouthguard and make sure it's comfortable. Each year, more than 5 million teeth are knocked out as a result of sports injuries. A custom-made mouthguard is a great way to prevent injury and keep a terrific-looking smile. Normally, as a permanent tooth comes in under a baby tooth, the roots of the baby tooth dissolve away and the permanent tooth replaces the baby tooth. In addition to being important for chewing, the baby tooth holds the adjacent teeth in place. When a baby tooth is lost early due to decay or injury, the adjacent teeth may drift together, causing loss of space in the dental arch. Fortunately, by placing a space maintainer, this loss of arch space can be prevented. It generally takes 2 appointments to complete a space maintainer. On the first appointment, orthodontic bands are carefully placed and an impression is taken. A duplicate model of the child's mouth is made from this impression so that the dental laboratory can custom make the space maintainer to the exact contours of the mouth. On the next appointment, the space maintainer is tried in, adjusted if necessary, and then cemented in place. Space maintainers are used until the permanent teeth begin to break through the gums. While wearing a space maintainer, it is important to avoid chewing gum, sticky candies, and hard foods like corn nuts or ice. Following up with periodic checks of the space maintainer here in our office will make sure it's still functioning properly and keeping all the teeth in their proper position. It's almost always a traumatic experience for both children and parents when a child breaks a front tooth. Fortunately, new bonding techniques and materials now allow teeth to be beautifully restored back to nearly new condition. We first roughen the tooth and a conditioning gel is applied. Tooth-colored material called resin is placed, sculpted to the desired shape, and hardened with a high-intensity light. It's important to watch for symptoms of nerve damage after a tooth has been damaged. Let us know right away if you see signs of discoloration, changes in your child's eating or sleeping habits, any new swelling, looseness, or pain, especially sensitivity to cold, and any sign of abscesses or gum boils next to the tooth. Once in place, bonded restorations generally last 3 to 7 years. Bonding is a great way to restore a broken tooth. The final result? A strong restoration and a natural-looking tooth. Ankylosis is a dental term for a condition where a primary tooth loses its normal ligament connection to the bone and becomes fused directly to the bone. This is a fairly common occurrence and is most often seen with lower first molars. When a primary tooth becomes ankylosed, 3 problems result. First, when the tooth root fuses to the bone, it no longer grows out at a normal rate with the other teeth. Because of this, it appears submerged compared with the other teeth. Second, the upper teeth need the lower teeth for support. With the tooth submerged, the opposing upper tooth grows out of the socket and also loses its normal alignment. The third and more serious problem has to do with the roots of the ankylosed tooth. About 50% of the time, the roots of the ankylosed tooth fail to normally dissolve as the permanent tooth grows in, and the permanent tooth is blocked out of position. The solution to these problems is the eventual removal of the ankylosed tooth. We'll work with you and your child to determine the best timing for the removal of an ankylosed tooth. Until recently, there was only one way to remove decay in teeth, with the traditional dental drill. Today, we're fortunate to have a new option that in many cases allows us to work without physically touching the tooth. This new technology is called air abrasion. Air abrasion involves the use of a special handpiece that creates a beam of abrasive particles propelled by a stream of clean, dry air. Air abrasion is particularly useful in children to help diagnose and repair cavities on the biting surfaces of back teeth. As the stream of air and particles crosses the biting surfaces of back teeth, the stain within the enamel is removed, and we can then place a sealant. This procedure may also expose hidden cavities, which can then be removed and filled. Now you know why we may have to delay the final diagnosis of cavities in back teeth, because the stains in back teeth require investigation with air abrasion before an accurate diagnosis can be made. Air abrasion, a wonderful new tool in dentistry that helps us provide the most accurate diagnosis and the most comfortable treatment for cavities on the biting surfaces of back teeth. We want the entire procedure to be comfortable for you, so the first thing we do is make sure you're thoroughly numb. Depending on the size of the filling and which tooth we're working on, we may use a rubber dam. It protects you like a safety net. Nothing can fall to the back of your throat. Then we remove the decay and shape the tooth with the handpiece. To mold the filling to the shape of the tooth, we first surround it with a thin, flexible band. A small wooden wedge between the teeth holds it snugly in place. We press the filling material into the tooth. White fillings harden when they're exposed to a bright light, while silver fillings harden on their own. Then we check the bite with a colored tape, which shows us where your teeth are touching, and we make sure floss still works. And that's all there is to it. In science classes, we learn to be very careful with acid. We have to be careful with the natural acids in our mouth, too, or we end up getting cavities. The enemy in the fight to prevent cavities is plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It isn't easy to see plaque, but look at how it shows up after we've stained it with red dye. If you don't remove the plaque every day, then the germs in your mouth produce acid that can eventually make a hole in your tooth. And that's what a cavity is. A small hole in the outer layer of your tooth. That hard outer layer of your tooth is called the enamel. Inside the enamel is a softer layer called the dentin. Once a cavity gets through the hard outer enamel and reaches the softer inner dentin, it can really grow quickly. That's why it's so important to have regular checkups and cleanings. We can fix your tooth while the cavity is still small and only in the outer enamel layer. We simply remove the decay and replace it with a filling. Fillings are a great solution when you have a cavity. But to prevent future cavities, floss and brush daily to keep all the plaque off your teeth. When it's wet and rainy outside, it's always a good idea to wear a raincoat. Well, when we work on your teeth, we sometimes use a special kind of tooth raincoat. It's called a rubber dam. This is a rubber dam. It's made out of stretchy, rubbery material. To put a rubber dam on your tooth, we first put holes in it that match the teeth we're going to work on. Then we put a special metal holder on your tooth. The rubber dam just slips on over the metal holder. We call it a dental clamp. We attach a special frame to hold the rubber dam tight and out of our way. Once the rubber dam is in place, it keeps your tooth dry and keeps anything from falling to the back of your throat. It keeps you more comfortable and lets us do a better job. When we're done, off it comes. Just like your raincoat at home, the rubber dam protects you and keeps things dry. One of the myths of dentistry is that baby, or primary teeth, are unimportant because they will eventually be lost anyway. Normally, some of the primary teeth remain in the mouth until a child is 11 or 12 years old. During this time, they serve as space maintainers and ensure that the permanent teeth are properly aligned as they grow into the mouth. Early loss of primary teeth often causes misalignment of the permanent teeth and may even alter normal facial development. Expensive orthodontic solutions may be necessary to correct these problems. Cavities or tooth loss may also make it impossible for a child to eat properly, and this affects a child's overall level of health. Speech development can also be affected by premature tooth loss. In combination, these problems may combine to lower a child's self-esteem during their important formative years. As you can see, primary teeth are critically important for a child's health and development. It's important to catch and treat problems of the primary teeth early and keep them in the mouth as long as possible. Until recently, there was only one way to remove small, worn-out fillings or decay in teeth, with the traditional dental drill. Today, we're fortunate to have a new option that in many cases allows us to work without physically touching the tooth. This new technology is called air abrasion. Air abrasion involves the use of a special handpiece that creates a beam of abrasive particles propelled by a stream of clean, dry air. Air abrasion is most effectively used for removal of small discolorations and stains and repair or replacement of fillings. The advantages of air abrasion over traditional techniques are no vibration and little or no heat generation, which means often avoiding the need for anesthetic, and accurate removal of the very minimum amount of tooth structure. Air abrasion, a terrific new technology that helps avoid the use of needles and that uncomfortable numb feeling, removes the smallest possible amount of tooth structure, and enables us in only a few minutes to place strong, natural-looking restorations. In the past, the traditional method of making an inlay or onlay involved a series of appointments and final fabrication of the restoration by a dental laboratory. Today, we have a new technology called CAD/CAM that allows us to custom fabricate tooth-colored restorations, crowns, and veneers here in our office and cement them in place, all in a single appointment. The advantages in using the CAD/CAM fabrication technique includes extremely accurate restorations, single appointment procedures, and strong tooth-colored materials that are bonded in place. The first step in the CAD/CAM technique is tooth preparation. The second step involves taking an impression, but now we use a special optical camera that records the exact dimensions of the prepared tooth directly into the CAD/CAM computer. After we carefully design the restoration, we then select an appropriate material of the proper shade for your specific tooth. We place this material into a miniature milling machine, which in just a few minutes carefully and meticulously shapes it into a highly aesthetic, custom-fitting restoration. We then try in the new restoration, add any necessary staining, and finally bond it in place. After checking your bite and making any final adjustments, you have a new, beautiful, one-appointment CAD/CAM restoration. Until recently, our only option in taking a dental X-ray was the exposure of a small film packet, which then took from 5 to 10 minutes to develop. Now the digital era has brought us an exciting new technology called digital radiography. Digital radiography has many advantages over traditional dental X-rays. It's faster. With instant viewing, there's up to 90% less radiation, with many effective image enhancements and electronic storage. And it avoids the need for hazardous chemicals necessary for X-ray development. We've replaced the film packet with a small sensor that connects directly to a computer. Taking X-rays is faster because reloading of the film positioner is eliminated. The sensor is merely moved from tooth to tooth. Now your X-ray can be seen on a computer monitor seconds after exposure. We can see details and make adjustments that are a tremendous help in our diagnosis, and we can save images in our computer system for instant retrieval at a later date. And there's more good news. The amount of X-ray radiation is up to 90% less than conventional X-rays. Digital radiography, an advanced new technology that speeds treatment and helps us make the most accurate and efficient diagnosis of your dental conditions. Though lasers have been used for many years in dentistry, only recent breakthroughs have allowed the use of lasers on teeth. Because lasers use coherent or concentrated light to remove unhealthy tooth structure, they have several advantages over the traditional dental drill. Less heat production means a reduced need for traditional anesthetic. It's quieter with less vibration. There's minimal tooth reduction. The laser provides a highly effective bonding surface. And without anesthetic, we can work in multiple areas of your mouth. Due to the brightness of the laser, we'll first provide you with special glasses. We then carefully move the laser over the damaged or decayed portion of your teeth. A water spray provides additional cooling. After preparation, teeth are usually restored with one of the new white filling materials that can be bonded to the teeth. The hard tissue laser is a great new technology that we can use to remove old fillings, repair cavities, and prepare teeth for bonding. It helps us avoid the use of needles and that uncomfortable numb feeling, removes the smallest amount of tooth structure, and helps us in the shortest amount of time place strong, natural-looking restorations. In the past, it was difficult for us to show you the problems in your mouth. But today, it's easy using a new tool to dentistry, the intraoral camera. The camera is about the size of a dental mirror. With a built-in light source, it gives us an easy-to-see picture. We can zoom in on one tooth with 25 times magnification or give you a tour of your mouth. We can show you broken fillings, cavities next to fillings, or cracked teeth. Intraoral cameras, a great new tool for dentistry. The widespread use of fluoride has made the surface of teeth so hard that the process of dental decay has actually changed. Before fluoride, decay usually attacked the exposed grooves of a tooth, where it could be found with a dental probe or X-rays. But today, fluoride has so hardened the outer enamel layer that cavities have gotten smaller and are much more difficult to diagnose. Where before, a dental explorer would catch or the cavity would show up on a routine X-ray, today, a cavity can easily go undetected. In fact, now cavities sometimes penetrate into the softer dentin layer through seemingly intact enamel. It's important to catch and treat all cavities early while they're still in the hard outer enamel layer. Once they reach the inner dentin layer, cavities grow much more quickly. If they reach the pulp chamber, it's time for a root canal. Microdentistry is a new dental science that uses special tools, decay-detecting dyes and air abrasion, to find, remove, and restore these new tiny hidden areas of decay. As a first step in microdentistry, we may apply a red or green dye that stains areas of decay. We can then use air abrasion or a small burr and the dental handpiece to gently clean the pits and expand the narrow grooves so that we can continue to test with cavity detection dye. Using small special instruments, we can then bond one of the new white filling materials or place a sealant. Microdentistry is a new science in dentistry that uses new tools and techniques to find and restore those new, small, hard-to-find cavities. We can remove the smallest possible amount of tooth structure. Place small, strong bonded fillings while often avoiding the need for dental anesthetic. The digital revolution has come to the dental office, and you're experiencing it right now. It's multimedia patient education on DVD. You've probably heard of DVD. It's the digital video disc, and it's the new interactive video format that's sweeping the world and will soon replace your home VCR. With DVD technology, dentistry is providing you with comprehensive dental information in the way you understand best, visually and verbally. This very presentation is part of the Clinically Advanced Education System, or CASE for short. With CASE, we can explain dentistry to you using clear narration and thousands of photos and graphics. We've invested in this wonderful new technology because we're committed to your comfort. We know from experience that when you understand what we're doing, your fears and apprehension will be greatly reduced. So as your treatment here in our office proceeds, know that we welcome your questions and encourage your participation. We're proud to offer CASE, the most comprehensive multimedia patient education program in the world. New breakthroughs in light-activated gels and high-intensity lights now make it possible to have a whiter, brighter smile right here in our office. Though you may experience a small amount of gum or tooth sensitivity for a few days following treatment, to minimize this, we use a rubber dam or a special protective material that we apply directly to your gums. We thoroughly clean your teeth and then apply a whitening gel to your teeth. A high-intensity light, or a laser, activates the gel. After each tooth has been treated, we rinse everything away and then repeat the cycle several times. Since every case is different, we carefully evaluate the results. We sometimes recommend additional bleaching at home or another session in our office. Power whitening, an effective new technology that can help give you a new, beautiful smile. Lasers have become part of our daily lives. They're in our computers, and we see them in the grocery store when we buy groceries. Now, with new advancements in technology, lasers have become an important part of dentistry. There are a number of different kinds of lasers, and they're particularly useful for treating the gums and other soft tissue problems. The benefits of laser treatment include faster healing, less bleeding, and reduced swelling. Before using the laser, we fit you with special protective glasses and then generally numb the area to be worked on. We then sweep the gentle beam over the area to be treated. The narrow beam only removes a specific number of cell layers on each pass. This gives us extremely precise control. Lasers can be used in a wide range of procedures, including cosmetic gum recontouring, lesion removal, treatment of gum disease, excess gum removal, and during gum surgeries. Dental lasers, an effective new technology that allows us to work faster and with more precise control, which means faster healing and less pain for you. The wand is a new computer technology in dentistry that helps reduce the discomfort when we numb your tooth. That typical pinch you may have previously felt was actually the pressure of the anesthetic. The wand eliminates that pressure difference, which in turn virtually eliminates any pain. This is the wand. The key to its effectiveness is a computer-enhanced motor that responds to pressure and controls the pressure and volume of anesthetic. The wand first delivers a small drop of anesthetic. Then as anesthetic begins to flow, the computer automatically produces an optimum flow rate. The benefits for you are a much more comfortable experience, a smaller amount of anesthetic, and specific tooth numbness, often avoiding the widespread numb feeling. We're pleased to introduce you to the wand, a reliable new technology that helps eliminate the pain and anxiety associated with dental anesthetic. Up until now, diagnosing cavities on the biting surfaces of teeth has been difficult. The traditional way to check for cavities was by seeing it in the mouth, checking on X-rays, or feeling for a soft area with a dental explorer. finding and restoring cavities early in their development has only gotten more difficult in recent years because of the widespread use of fluoride. Fluoride so hardens the outer enamel layer of teeth that cavities have gotten smaller and are much more difficult to diagnose. Where before a dental explorer would catch or the cavity would show up on a routine X-ray, today a cavity more often goes undetected. Fortunately, we now have a new technology called the Diagnodent that can help detect cavities early on, enabling us to provide treatment before your tooth is at risk of more extensive and expensive treatment. Diagnodent uses laser technology to scan your teeth with harmless pulses of laser light. When a cavity is present, fluorescent light of a different wavelength bounces back to the sensor, which is translated into a digital readout and an audible signal. In general, the higher the number, the greater the amount of decay in the tooth. This laser technology helps us find decay that may have previously gone undetected. This allows us to now deal with the decay at an earlier stage, preventing more extensive damage. The biting surfaces of back teeth are one of the most common areas for tooth decay. Up until now, they've also been one of the most difficult areas to diagnose. Today, with regular dental exams and a terrific new technology, Diagnodent, we can find and treat hidden decay in its earliest stages.